Welcome to the American Institute of Healthcare Professionals video on the stages of addiction. In this video, we're going to look at addiction and its various stages and how you enter and exit it. Now, addiction is an unhealthy attachment to substances, but also to a variety of practices. So addiction can be physical, physiological, mental, as well as behavioral. Most addictions are due to improper coping methods that sometimes grow out of control. So individuals who enter an addiction usually enter into it due to maybe a mental trauma that they experienced or something bad that occurred. Sometimes it's due to immaturity. It can also be due to a misuse of various pharmaceuticals, and an addiction takes place. It envelops the individual. So when this occurs, the coping methods to deal with the particular issue becomes maladaptive through the drug or the practice itself. Now, sometimes it's not so much just a consequence or a reaction, but it can also be due the addiction to genetic backgrounds that make individuals more likely to fall into a particular addictive habit. Dr. George Valiant listed various stages of addiction, and he listed three that are primary and most important for purposes of this topic. The first is experimentation, and this is utilized through amusement or binge use. So an individual might just decide on a particular day, especially younger individuals, if they're bored, just to try something. And then that becomes what you would refer to as binge use, where it's maybe done once a week or once a month. And it's used just because of usually boredom or something to do with friends. Now, sometimes this experimentation can also be used, as mentioned on the previous slide, due to escape intense pain. So it's a maladaptive purpose with this particular experimentation. Now, the abuse phase is a continued use of the drug, sometimes even alone, even if social, financial, and family life deteriorates. So one's job, individual might start showing up later because of the use of this particular drug, or they might not have as much funds available because they are spending too much money on this particular drug. So a continued abuse begins to take place despite all the consequences that are taking place. Now, this abuse, according to Dr. Valiant, eventually leads to dependency, where there is a necessity of the drug to function. One then develops a higher tolerance and they need more. They suffer more severe withdrawal symptoms, and there is a significant disruption in life, just not maybe missing work here or there, but losing a career, losing a marriage, becoming disassociated with family. So we see how this works. This is the beginning of experimentation, where one unknowingly sometimes falls prey to a particular thing just due to a fleeting moment, which leads to a continued systematic approach of abuse, which then leads to the final ensnare of the trap, where one becomes completely and totally dependent on it. Now, after one becomes dependent, how does one exit addiction? Now, obviously, some have an easier time exiting a particular addiction because it's more behavioral and various cognitive therapies can help. But when addictions become more physical, it becomes difficult for an individual, especially those that are addicted maybe to opiates or more addictive level drugs, where they become hooked unknowingly. So exiting addiction is far harder than entering addiction. It's easy to enter a particular day or so where you try something you probably shouldn't, or have too much of something you shouldn't. But by the time it has ensnared you, exiting becomes very difficult. And it starts with the process of recognition and a commitment to change. And until that recognition occurs, until someone reaches quote unquote rock bottom, sometimes that recognition takes a long time. And for some, that recognition may never come because they might injure themselves or die early due to overdose. So that's a sad tale. But until recognition and commitment is determined by the individual, nothing can occur. After this recognition, various coping mechanisms are essential to exit. Some of those are behavioral cognitive therapies that can be dealt with in therapy. Also, various support systems with family, but also various support groups with alcohol. Alcoholic Anonymous is a very important foundation organization that can help individuals through a 12-step process. So despite all these support groups and systems and therapies, relapses can still occur. It's it can be very disheartening for an individual who has tried so hard maybe to have a relapse. And sometimes a relapse can undo all of the work that an individual has done. So it's very important to have a cognitive paradigm in place that if a relapse does happen, that is just one day. It doesn't undo all of the good work that one has done. So you have to be able to get back up again. So relapses need to be considered within the process of exiting, not unheard of at all. After we've gone through a numerous set of coping mechanisms, supports, and relapses, I think one of the other important parts of exiting addiction is understanding that it is a lifelong journey. It is something that is constantly going to be there, something that individuals are going to have to identify various triggers, emotional triggers that could put someone into a situation where they might want to try it again, or a situation where they're at a special event where the particular drug or practice might be present. So staying away from various things that could pull you back in to the addiction, various triggers or occasions of quote unquote sin. So it's a lifelong journey. And various substance abuse practitioners, licensed counselors, and others can help with coping mechanisms, with various therapies, and support groups can help give other individuals the need that they have to rely on each other, especially again with AA and the 12-step method itself. So at AIHCP, we do offer a substance abuse practitioner certification for qualified professionals, usually those in counseling or social work. But it can also be from a pastoral venue as well, although unlicensed counselors that work in the pastoral field have less abilities to help than some. But addiction itself and helping individuals is not solely a licensed field in itself. So you have a lot of individuals who run support groups and things of that effect. So this certification is very helpful in granting an education on addiction and helping individuals face addiction and overcome it itself. Below is our link. Our number is 330-652-7776, and our email is info@aihcp.org. I'd like to thank you for listening and have a good day.